I started with the back pain in last November, and I went to the ER the second day. They couldn't find nothing. They did the heart monitor all night, sent me back the next day. I went to my regular doctor, so she sent me for the MRI. MRI showing nothing, so she gave me just the muscle relax pills. And the same day my knee got swollen. I couldn't walk. So then they sent me for the orthopedic. Orthopedic sent me for the X-ray same day, and next visit he sent me for the MRI. Couldn't find nothing. The third visit they sent me for the bone scan. But the pain was never stopped. It was like a non-stop. I couldn't sleep. I can turn my, And in the last visit I went, they couldn't find anything. So he sent me. He said he can't do anything. So he sent me to the different doctor. So I saw your YouTube video. I could have, I said, what's going on with me? Like let me find. I see the videos, and then I called you, and then I made an appointment.
Okay. All right, so go ahead. Let's lift up your pant sleeves. Let's show what your knees look like. Okay, so comparing from the right to the left, we can already see there's a significant amount of swelling right over here. Okay, so we're gonna take a look on that fella, see what's going on, right? And we can take it from there.
Okay.
Here's the deal with your case over here. And I see a very particular type of structural abnormality. Okay. See the width of this hip bone over here versus this? Okay. It's a much more narrow versus this one over here. Okay. This one over here, and more importantly, see this line over here? Okay. So that's simply put, okay, this is like our butt crack shadow over here. I want to see it centered over here. Not way out there. Okay. So the bottom line is this: your hip went all the way like this. Okay. What I want to see is biomechanical measurements somewhere between 2 to 3 millimeters of misalignment. Okay. That's a moderate problem. But once you're starting to go 7 millimeters or more, okay, your body has a lot of trouble to compensate for that kind of significant type of misalignment, and that's what you got. Okay. It's not just 7; it's 10 millimeters. Rotated way to your left. Okay. In addition to, okay, your body just follow along the same thing as well. Okay. The rest of your body also twisted up this way. All right. So that's the strategy for correcting this one over here. We're gonna correct this way in a very special way for you. Okay. And also, same token, take all this rotation out as well. Okay. This knee over here. This is your right knee over here, and this is your left. Okay. So what I'm saying is this: outside of your knee is gapped open. So that helps explain why you feel a lot of tenderness and discomfort on the outside. Okay. And also it's more narrow on the inside over here. Okay. This is our kneecap, okay, the patella. It shifted way over to the outside. Okay. And you see this over here? It shouldn't be gapped open like this wide over here. Okay. So that tells me, okay, it's this femur bone that's involved over here. And in addition to, it rotated backwards. Okay. Okay. So that's exactly what we're going to find over here. Okay. That's going to be a PEX femur, and that's what we're going to correct. There you are, right there. So you can see over here, there's a lot of swelling right at this sacroiliac joint. Okay. Tender right there?
Yeah.
Yeah. More so on this one here, right? And we compare it to the left side?
Not that much.
Not that much. But over here, very painful, right? Okay. Now we're going to motion this fella. So we compare to the left side. Your left hip moves forward and backward without a problem. See that right there? That's a brick wall. That's stuck right there. It's just not moving. And it's very painful to go that direction, right?
Oh, yeah.
Yeah. So that one right there, that's where the problem is. Okay. So there's a lot of swelling right over here. Okay. I understand. It's a little very tender, right? Okay. I'll raise slowly upwards. Okay. I'm just doing it very lightly, and we could tell. Okay, it's very stuck on this side over here. Okay, so it's not moving. So here's the deal. Because of significant swelling, what we find in the knee and also in the sacroiliac joint, what we're gonna do is we're gonna ice these fellas, okay, before we correct them. Okay? That's the shoulder. A little more. Right there. And you notice anything different?
Oh, yeah, I can. My knee, yes. Less pressure on my
Over
knee.
there, down.
Okay, now come this way.
Oh, yes, definitely. I see the difference. I mean, I can put pressure on now.
Good.
Oh my God.
Oh, we're still not done yet.
Oh my God. 2 months and I was.
Okay.
Definitely, I see something like
Good.
light. Hey.
Oh, wow.
Hey.
Yeah, that's good.
Hey.
Just gonna pump it up. I know.
Oh.
This is not fun. This is really messing up. Okay? Just right here. Just
Hey.
breathe.
Oh.
Breathe.
Oh.
Breathe.
Oh. Oh. Oh.
You don't exactly have a true misalignment. It's more like a compensation that turned into a problem.
Okay.
Because your hip rotated this way,
Uh-huh.
take a look. What did it do to the knee? Okay. It rolled inwards,
oh.
right? So that's why it was wearing out on the inside. Okay. It was gapped open on the outside.
Oh.
So that's why there's a lot of discomfort going on into this knee.
Oh.
So that's why when we corrected your hip, okay, from the external rotation into the proper position, that's what took a lot of pressure off that knee.
Oh, okay.
And that's why you felt a lot of relief on that fellow,
Yeah.
right?
Mm-hmm.
Okay. So we still corrected this fellow over here because there's still some rotation into this knee over here.
Okay.
We had to do our job and alleviate the tension
Okay.
off of this fellow over here.
Hey.
Good. It's moving. Okay. Try to walk around.
Think I don't need it. Yeah. I see like my knee, how like move. I
What's
see-
different right now?
I see my knee moving a little bit now. Not that much
Mhm.
yet, but yes, I can. Before I can bend,
Mm-hmm.
now I bend it.
All right. Well, how do you like that, huh? How's the low back and the rest of your
Yeah,
spine?
I don't feel any pressure here.
You also mentioned you experienced a lot of tension going all up to your neck.
Yeah,
How's that
it's
now?
like, yeah, it's less now, but still like, yeah, I don't know. I'm okay.
Well, how do you like that, huh?
Yes.
Okay, so your body needs some time to heal up on this. Okay,
Okay.
so we'll see you next week.
Okay.
All right?
All right.
We're all set.
All right. Thank you.
You're welcome.
Thank you very
Oh,
much.
thank you very much. Yeah,
To save my
you're
life.
welcome.
So good. Like when I went after from here, the first day after 2 months, I sleep 6 hours. Continue. I never slept 2 months, like 2 hours, 3 hours. I feel like much, confident. Like I can get better.
Mm-hmm.
Thank you.
Oh, you're very welcome.
Yeah.
Okay.
Less pain, no pain that day. 3 days, no pain.
Mhm.
Little bit yesterday, I feel little bit. Maybe, that's progress. So
Mm-hmm. It is.
hopefully, yes,
All right.
definitely.
So as
Thank
we
you.
mentioned before, it takes time to correct your structure. This
Okay.
is not a one-shot deal.
Yes.
There's significant damage to your structure, so it's going to take some time to
Okay.
correct your problems. Okay.
Okay. Thank you.
All right. You're welcome.
Thank you.